human body is the best work of art, a marvel really, an intricate system with the cells, blood, organs, and muscles all coming together to function properly as a whole. Each and every organ, big or small, needs to function effectively as a very important part of a well-oiled machine. Hello, everyone, and I'm your host, Ruchira Sharma. A very warm welcome to this educational series about health and nutrition presented by Abbott and News18. Today, the focus is on the importance of nutrition in liver health. So, just to set the context here, the liver is among the most important organs in the body for digestion and detoxification. It is a very important organ because besides filtering blood by removing toxic elements, the liver also performs various other vital functions like metabolizing fats, carbohydrates, and proteins. But how does the liver really function? What are the reasons for liver disorders that are becoming increasingly common? And how can we prevent them? What are the signs that we should look out for? And how important is nutrition in keeping our liver healthy and functioning properly? So, to discuss and understand all these points, we are being joined by an eminent panel of doctors. We have with us Professor Dr. Gurdas Chaudhary. Dr. Chaudhary is currently associated as Chairman, Department of Gastroenterology, Hepatobiliary Sciences at Fortis Medical Research Institute, Gurgaon. He is one of the leading gastroenterologists, medical educator, and researcher of national eminence. As Honorary Secretary and President of the Indian Society of Gastroenterology, he has played a leadership role in developing liver and digestive health in the country. So, welcome to the show, Doctor. And we also are joined by Dr. N. Murugan, who is currently associated as Senior Consultant, Chief Hepatologist, and Transplant Physician, Department of Hepatology, Apollo Hospitals, Chennai. He is one of the earliest hepatologists from South India. He has been involved in liver transplantation for the past 13 years and has experience of approximately over 1,000 patients who have undergone liver transplant. So thank you both for joining us today. And as I mentioned, we are here to discuss the importance of nutrition in liver health. And my first question is to you, Dr. Chaudhary. Liver performs a very important role in keeping our body healthy. So could you please enlighten us a little more about the primary functions of the liver in our body?
I think you mentioned some of them. The number of functions that the liver performs is so long that it would take me the whole evening to tell you. But in general, what you said is absolutely right. It detoxifies the blood, or in other words, it purifies the blood. It excretes toxins from the body to the outside. And, it mops up ammonia without, if it gets too much of it into the blood circulation and to the brain, then it causes problems. We get into encephalopathy. So those are the kind of things which the liver does. And unfortunately, the liver has got so many functions, and because it's got a lot of reserve, so it's 1.5 kilograms in weight. It's one of the largest organs in the body. And we tend to take it for granted in the sense that most of us are more obsessed with the brain and the heart. Not to say that they're not important, but actually you can't live without a liver. And that's the reason why the liver is so important, and its importance is getting to be understood more and more nowadays. It's a wide range of functions, which you very rightly mentioned.
All right. Thank you for sharing that. Coming to you, Dr. Morgan, what are the
Mhm.
causes and predisposing factors for liver disorders, and how can one avoid them?
Liver disease is interesting because almost all the major liver disease are preventable. That is the beauty of the whole thing, because we deal with a lot of end-stage liver disease where patients are either dying or need a liver transplant. But
Right.
almost all the reasons why people get liver disease are entirely preventable. So in liver disease, you have two kinds of liver diseases. One is called acute liver disease, where things happen suddenly in a normal, healthy person.
All right.
Most commonly, these are infections. All of you know what jaundice means, where the eyes and the body gets yellow due to inflammation of the liver. So jaundice typically comes from a viral infection. The most common is hepatitis A, and in some parts of the country, we have a virus called hepatitis E. So these are infections that come from food and water,
All right.
and they predominantly affect the liver, causing inflammation and jaundice. So again, with good hygiene these can be prevented. Many times, drugs that we use either knowingly, unknowingly, or recreational drugs, or self harm drugs, they can also affect the liver.
All right.
And then we have a group of conditions called chronic liver disease. And again, many of them are preventable. The most notorious is alcohol. I think all of us and public associate alcohol with liver damage. And it is very true, because still the majority of liver disease in our country is due to alcohol, uh, which is entirely preventable. If you don't drink, you won't get liver disease due to alcohol. There are two viruses which cause chronic or long-term disease. They are called hepatitis B and hepatitis C. They come from blood exposure, which is also preventable depending on the healthcare exposure. And hepatitis B has a vaccine, so if you take a vaccine, you can protect yourself. And they also cause chronic liver disease. And finally, there is an epidemic silently growing in the community called NASH. NASH is fatty liver, which comes from having obesity, having diabetes, hypertension, a combination of these factors. Again, with proper diet and maintenance of body weight, this can also be prevented. So almost all the diseases that affect the liver, except a few inherited disorders and so on, it can be prevented. But unfortunately, we do see a lot of them. So obviously more needs to be done on the preventive aspect, I feel.
All right. That's really heartening to know, Dr. Murugan, as you pointed out, that with the right nutrition and with the right approach, liver disorders can be prevented. Coming to you, Dr. Chaudhary, how common are liver disorders in the Indian population, and which liver disorders are more commonly seen? Do they, in fact, affect any specific age group?
Yes. So liver disorders, if you were to look at population and find out how many of them have a liver disease from mild to somewhat severe, it would be a pretty large number. I mean, especially in urban India, it would be to the tune of about 30% would have extra fat in the liver. Doesn't necessarily mean that all of them are dangerous, or that they are going to actually go down the slippery slope to death immediately. But the beginnings are always there. If you look at how much liver disease contributes to our, shall we say, death rates, well, liver disease accounts for the top 10 causes of deaths in the urban population. So that's a matter of concern. Obviously, we have the heart disease at number 1 position, then you have strokes, cancers, and so on and so forth. But it's around 9th or 10th ranking is of liver disease. So that more or less gives you a glimpse that, look, I think it does have a major impact on society. With regard to your question, which is the commonest liver disease? Well, that's been a phenomenal change. I think by the time when we were students in the 80s or 70s, it used to be infections, hepatitis B and C and A. Now, as Dr. Murugan very rightly said, that the majority of the problems are related to lifestyle disorders, either consumption of alcohol or extra amount of calories going into the body, which makes which leads to the condition called non-alcoholic fatty liver disease or fatty liver. So these are enormously common now. And just the last quick word I'll tell you, there has also been an evolution in our social practices.
All right. And any specific age group that they are impacting?
So, in childhood, usually the problem is not so severe except for the infections which Dr. Murugan mentioned, like hepatitis A. It's water transmitted, but nowadays, with better potable waters and all that, those frequency of those infections are coming down.
All right.
Fatty liver disease usually starts in the late 20s and 30s. And that's a very typical age when you find a young person who used to possibly play for the football team in the school or college, or there was a girl who used to dance Bharatnatyam, and then she starts pursuing a career and settling down. So we pile up a lot of calories, so our weight goes up, and then fatty liver disease starts. And again, the same applies for alcoholic liver disease. You see, you start under peer pressure probably in college or thereafter. And after that, of all the people who are exposed to alcohol, there would be some who tend to get more and more attracted to it, and then it becomes a habit, and then it leads on from there into alcoholic liver disease. So this is the way things happen. So by the time they manifest with chronic liver disease, as Dr.
Mhm.
Murugan said, they're usually in the range of about 45 to about 60, and that's the age group where clinically significant disease is there. But if you were to do an ultrasound before that, or maybe a
Mhm.
liver fibroscan, you would pick it up much earlier.
All right. So, Dr. Murugan, what are
Mhm.
the most common signs and symptoms that a patient shows when suffering from chronic liver disorders?
The most common symptom known is jaundice. Jaundice simply means the bilirubin in the blood is increased, and that gives a yellow tinge to all the tissue that are supplied by blood. The most visible are the eyes, and
Mhm.
later the skin, and the whole body becomes yellow. But jaundice is a symptom. Many public think jaundice is a disease, but it's not a disease. It is a symptom of mainly liver disease,
All
which
right.
can occur in both acute situations like viral hepatitis and in chronic diseases. In chronic diseases, it occurs quite late in the disease. In the early stages, you may not have it. The most worrying aspect about liver disease is throughout the early or middle stages of the liver disease, there are hardly any symptoms.
All right.
You take alcoholic liver disease, NASH, or even chronic viral hepatitis, they carry the problem for 10, 15, or even 20 years.
Mm-hmm.
And some of them go on to develop a condition called cirrhosis of liver, where the liver gets damaged, shrunken, and nodular. And because the liver has a capacity to work even with only 20-25% function, it can perform most of what it needs to do without the patient noticing it. So that is a worrying aspect because then patients come very late for diagnosis.
All
So
right.
most of the time they won't have symptoms. Many of them they say they have fatigue, a little bit tired, but you pass it off as stress or work or whatever, or just day-to-day issues. But once the liver starts to fail, that is beyond a certain level of damage, then a lot of problems can come, which are swelling of the feet and stomach, blood vomiting, confusion, lack of sleep, difficulty to concentrate, and so on. So these are all grouped under term of liver failure. So that comes quite late in the disease. So the answer is that apart from jaundice, there are not
Mhm.
much early signs or symptoms, and you have to just look out and pick it up at an early stage to help the patient.
All right. So that's very important that they aren't
Yeah,
very obvious signs here.
yeah,
All
yeah.
right.
So
Dr. Chaudhary, what is the impact of liver disorders on the nutritional status of the patients?
So it's both ways. So when we talk about nutritional status, what normally comes to mind for most people is that there's a fellow who's starving or not getting enough to eat, so he's emaciated and so on and so forth.
Mm-hmm.
That is obviously a matter of concern because for healthy liver you need a good amount of protein intake and a good amount of calorie intake.
All right.
On the other hand, in terms of what is now getting to be more common, that is called the non-alcoholic fatty liver disease or fatty liver disease, it's
Mm-hmm.
actually the other way around. The imbalance is in nutrition in terms of the fact that one is consuming far more calories than what one is able to burn.
Burn.
So our exercise levels are down. We are eating
All
a
have
lot of
sedentary jobs. Yes.
yeah. So we are eating a lot of calorie dense food. So you go to any party and the more social you are, the more parties you'll attend. So you'll actually have pastries and chips and you'll have all these what are called as calorie dense foods. Okay. And they get into the body very easily. But for each one of them, so maybe if it's a rasgulla, for instance, you might actually have to walk or jog for about a kilometer or so to be able
Just
to burn
more.
that,
Yes.
which we are not doing because then we have the car waiting outside and we are on a desk most of the day. So
Mhm.
that's the reason why there is a huge amount of accumulation of unnecessary calorie nutrients in the body, which is fueling this epidemic, which is called non alcoholic fatty liver disease. Your question, the other part of your question is very important. So, if a person has chronic liver disease, what's the kind of food that he should have, or what should be the impact of his liver disease on nutrition?
Mm-hmm.
Several of them. So, they obviously have poor appetite. There is water in the abdomen, so they are not able to eat much. But what they really require is salt restricted high protein diet for patients who have got chronic liver disease. And that's
All
a very difficult thing to achieve because, on one side, if you reduce salt, the appetite goes down. But on the
right.
other side, you need to give protein because the albumin levels are down and you need to build them up.
Catch 22.
It's
Yes.
a very complicated case.
I just want to add to what Dr. Gurdas said.
Oh,
Apart from lack of intake of calorie, the chronic
mhm.
liver disease also breaks down protein and burns more calories than a normal body would. So
All
the
right.
expenditure is quite high compared to a normal liver. So apart
All right.
from less input, they also have more output. And what is most noticeable, I'm sure Dr. Gurdas will agree, is the protein breakdown and muscle loss and loss of muscle function, which is a term we call sarcopenia. It's a very
All
common
right.
and kind of a serious problem in chronic liver disease because these patients don't do very well in terms of the survival and outcomes. So it is a big challenge to deal with this. So I probably will talk more about it later.
Sure. Dr. Murugan, actually, I wanted to ask you the next
Mhm.
question. Are there
Mhm.
any simple techniques by which nutritional assessment can be done easily?
Okay, yeah. So traditionally, to see how healthy a patient is, we look at the weight, and
Mm-hmm.
more important is the body mass index, which is the height to weight ratio.
All right.
Which is a good way to assess a person's nutritional status in a healthy state. So you want to know how much weight you are you overweight, underweight, or correct weight. So this is a good enough parameter. Um, and in particularly with fatty liver and NASH, we can also look at the waist circumference, which is many times linked to the risk of fatty liver and complications. So
Mm-hmm.
a waist circumference of 90 for men and 85 for women is supposed to be ideal to prevent fatty liver.
Mm-hmm.
In liver disease, this it becomes a little difficult because of other factors. For one, we talked about having fluid in your abdomen or fluid in your body, which will
Mm-hmm.
artificially increase the weight, and you'll think that you're healthy, but actually you don't have much of muscle or the mass in your body. But most
All
of the
right.
weight is due to the fluid, which is not good fluid. So we need other ways to assess the nutritional status.
All right.
So there are some techniques that we use in hospitals or healthcare settings.
Mm-hmm.
We call it the hand grip test. So that is a good way to do. There's a bioelectric impedance. So these are specific tools designed to assess the nutritional status of each patient,
All right.
and others to measure the thickness of certain muscles in your body. You can do advanced tests like DXA scan, CT scan, MRI, and so on. So then you're coming into hospital or doctor-based techniques to assess somebody's nutrition.
Mm-hmm.
So ideally, to assess nutrition in a liver patient, you need a dedicated team of experts,
All right.
a doctor plus a nutritionist to do all these tests, assess the nutritional status of each patient, and tailor the treatment to that particular patient. That is the best way to do it.
Sure. So nutrition is, of course, very important here. Dr. Chaudhary, how commonly do you see malnutrition associated with the patient who's suffering from chronic liver disease?
Very common.
There are official figures also, where people have actually done this, that every patient who walks in with chronic liver disease, you do an
Mhm.
assessment. And the figures are actually that about 80% of them have malnutrition.
Mm.
Now,
All
as I
right.
told you, when we say malnutrition, it doesn't mean that it is a emaciated, starved kind of a situation.
Mm-hmm.
Mal means faulty. So it could actually be both ways. So it could be that there is excess calories in the body, too much of fat. That's also malnutrition. On the other hand, when we look at the extreme endpoints of chronic liver disease, we find that there is a low albumin, there is swelling of the feet. So protein intake and protein metabolism is grossly affected. So that's another issue. And what Dr. Murugan mentioned, that's a very interesting phenomena which we are all recognizing called sarcopenia.
All
Sarco
right.
means muscle and penia means less muscle. And,
Okay.
earlier on, people were much clearer in giving descriptive uh, details. So,
Mm-hmm.
one of the doyens of hepatology described this condition as a lemon on matchsticks. So,
All
if
right.
you can imagine that there is a lemon, which means that, the central part is swollen because of the water, and
Mm-hmm.
matchsticks because your arms and your legs are very
Right.
thin because the muscles
Correct.
have atrophied. Now, that's
Mm-hmm.
actually a very proper descriptive method. The only problem is that in today's time, with so much advance, one shouldn't wait to see those, the terrible end stages of liver disease, but one should be aware that muscles are equally important, as Dr. Murugan very rightly said. And there are
Mm-hmm.
so many other ways, both anthropometric as well as blood tests, which tells you about the nutritional status of the liver.
Sure. So, Dr. Murugan, when we talk about better liver health in chronic liver disease patients, what are the things that need to be added or avoided?
Okay. So in chronic liver disease, Dr. Gurdas Chaudhary already mentioned about salt intake. Many of them, because of the liver disease and the changes that happen, the physiological changes, tend to retain salt from the kidneys and then they accumulate in the body and you fill up with water, which is not good. It's bad in many ways. You get infection, you can't eat, you can't move about. So it adds to the patient being more unwell and also get complications. So the first thing we tell them is to cut down salt, which is very difficult because then they just don't eat and then they don't get calories. But salt restriction is a very important part of the diet for a chronic liver disease patient, especially if they have complications.
All
So
right.
that is something to avoid. What they need lots of is protein because they are breaking down protein, they're not getting adequate protein. The liver is not able to synthesize enough protein, so they need a lot and lot of protein,
Mm-hmm.
much more than a normal individual needs. So
Okay.
protein can be both animal protein, eggs, fish, meat, and so on, or vegetable protein. In some situations, we preferentially use vegetable protein,
All
but
right.
most of the time, both are okay. So in vegetable protein, all the dals and they have a lot of protein, specifically milk and milk-related products like paneer can be taken. We encourage a lot of soya, which is
All
less
right.
widely used in India, but it's a very good source of protein from
Sure.
vegetables. So these are some of the things you can do. And of course, if you use fish and egg, it's easier way to give protein.
Sure.
And in many situations, we use supplements. We use protein supplements because the patient cannot eat enough to give a certain amount of protein that they need.
Mm-hmm.
So we use protein supplements in the form of food preparations, either powders, liquid form, and then they take it a certain amount, whatever is prescribed, they take it per day.
All right.
There is a group of proteins called branch chain amino acids, which are more specifically reduced in liver disease, and they
All
seem
right.
to be important both for overall well-being and for liver health. So that can be given as a supplement. So these are various ways where protein can be increased.
But just
And
one question, is
mhm,
assimilation proper in these patients? Like when they take this kind of nutrition, external supplements, are they able to really absorb and assimilate the benefit?
it is difficult because there is a catabolism or protein breakdown that is accelerated in liver disease. It is difficult, but we have to somehow redress the balance. So we just give more than they normally take and try to maintain them until they get better or until they get a transplant, whatever the outcome may be.
Sure. Dr. Chaudhary, would you like to add something to this before we wrap up?
Yeah, just two quick points. One is that, if a person is a little overweight,
Mm-hmm.
we often, in normal people, we often recommend calorie restriction and to some extent even fasting once in a while. But one has to realize that for patients of chronic liver disease, they should not have long periods of fasting.
Mm.
And
All right.
that's the reason why, in fact, they're advocated that they should take a late night or a late evening snack, which should be
Mhm.
oats or something of that type, because you don't want the liver to starve, because then it deteriorates further. The
All right.
second point that I want to send across as a message to everybody is that,
Mhm.
we feel that calories are important, and one of the easiest source of calories is sugar or sweets. But in this group of patients called fatty liver disease,
Mhm.
it's the sugars which are actually the bigger culprit. So they actually get converted into triglycerides, which get deposited in the liver. So a healthy lifestyle would actually include keeping off sugars and sweets and carbohydrates to as much as possible, focusing on proteins, the which Dr. Murugan has talked about. And last
Mhm.
but not the least, although it's not a part of nutrition, but exercise is a very important part of maintaining nutritional balance.
So, all right, Thank you so much for sharing your insights with us, doctors. And all this information about health and nutrition is very important for all of us. So I really hope we all are able to follow your advice and take good care of ourselves. So that brings us to the end of the session. We'll be back very soon with another healthy, valuable, and educational session very soon. So thank you both, and thanks to our audience for watching the show.
Thank you so much.